ain't paying $2. All right. Well, first things first. I told you I was going to answer you before lunch. Here's the answer. Here's the magic. You need to first, any part of the root that is exposed to the oral cavity, any part of the implant, abutment or implant body, has to be mechanically debrided. With teeth, I use a back action scaler. With implants, I use micro titanium brushes. Salvin has them, Neobiotech has them. I think there's a few other companies that do sell them. I use the micro ones from Salvin because they're very small and they can get in between the threads of an implant. So if it's an implant, titanium brushes. If it's tooth, I use a back action scaler. And you want to actually physically see that you remove a layer of the tooth structure. When you're scaling that tooth, I'm not talking about plaque. I assume that that's been washed away and cleaned. But you should actually see a little bit of tooth structure come off when you're scaling. The reason that you're doing that is you want to take away any of the surface material that has been affected by bacteria from the oral cavity. Then you're going to mix, I like to use tetracycline. There are a lot of other options I'll show you in a moment. I mix this with lidocaine, I get it into a slurry paste, and I place it on before I make my incision onto the root surface, and I leave it there for 3 minutes. The reason I like to do it before I raise the flap is because tetracycline is acidic, and I don't want acidic byproduct on the bone or periosteum. So I like to keep it from the subgingival area from the surgical wound. So do it before you raise the flap. I know on my video I showed you one that I didn't, but you should do it always before. What's the history of this? As I told you, I'm not big for keeping you. Day lecture taught me a lot about history, but there is a history of root preparation, mucogenital surgery, tetracycline, 1977, EDTA in the 80s, citric acid in the 60s, enamel matrix protein in the 90s. They are all root conditioning agents. I choose tetracycline because you remove the smear layer, it opens up dental tubules, and it promotes fibroblast proliferation. One added benefit of tetracycline, it's an antimicrobial. So you do have an antimicrobial effect. When you're done, when you wash it away, it will look a little frosty, almost look etched. And that's probably because of the low pH. You're probably at about a 2 pH of tetracycline. So you almost get an etched surface. Why is that good? Because when you place your graft, you want the graft to insert itself, the connective tissue, into the dental tubules that have been opened up into the root surface.